Welcome to the New Health. As people are getting sicker and sicker at younger ages, we are bringing healthcare leaders to our audience to speak with you about how they are revolutionizing healthcare and making change in the world. I'm your host, Jessica Preston. Back with us today is Dr. Andrew Sun. He's a men's health urologist at Urology Partners of North Texas. Every time it gets me just a little bit. So welcome back, Dr. Sun.
Thank you so much. Great to be here.
So today is our last segment with you, and I'm really sad maybe you'll come back someday to see us. But I'd love to ask you what you would like to tell us about in healthcare.
Sure. Yeah. There's so much in this men's health, sexual health space. One of the disease processes that I have basically made a big part of my career is something called Peyronies disease. For those of you that haven't heard of it, Peyronies disease is not even a good name because what it is basically scar tissue in the penis that causes a deformation of the penis. It can be a curve, but it doesn't have to be. It can be a shortening, it can be a narrowing, it can be a restriction. Basically, something has happened to the penis, scar tissue is created, and it causes a malformation or deformation of it. This is way more common than people think. It may affect 7, 8, 9, 10% of men. We believe that the genetics started in Scandinavia and spread with like the Viking conquest, and so Northern Europeans probably have the highest incident, but not necessarily just Northern Europeans. And it can be a devastating psychological and emotional condition. You basically can have pain with intercourse, you can have an inability to have intercourse because of a deformation, you can have length loss. It hits a lot of guys really hard, and unfortunately, I think historically the medical establishment has not been very good at treating this. Even amongst my urology colleagues, most people don't have a great treatment understanding of Peyronies disease.
But it is treatable?
It is treatable,
okay.
And we'll get into that. But we'll start with what is it, and essentially it's collagen scar. So the way that I talk to people, imagine your penis is a balloon, kind of the long ones you like fold into a dog at the carnival, and I slapped a big piece of tape on the top, right? When it's deflated, you don't notice much. When you inflate this, that top segment is not going to inflate as much as the bottom, so it's going to cause a curvature. It's also going to cause a constriction. It can cause that portion to be narrow, and that's what Peyronies does. In the beginning, it can be painful. Eventually, usually the pain goes away. Now, most people who come into my clinic with Peyronies, they say, I don't remember injuring my penis. I never had like a traumatic incident. And I tell them, you and 85% of people, right? It's only about 15% of people have some kind of memorable incident where like you missed landing or something slipped and it like torqued. Usually it's not. It's what we think is acquired micro trauma, essentially wear and tear on the penis that happens over time. When you're having sex with like a 8 out of 10 erection, you don't really see Peyronies in 20-year-olds, you see it a lot in 50-year-olds. Right? So the first element of treatment is to make sure you buff up those erections to resist further damage. Cialis, Viagra, these kinds of medications. Then if you think about what that scar is, it's collagen. So historically, the only thing you could do was operate on it. The reason why it's called Peyronies disease is named for this guy, Francois Gigot de la Peyronie. He was like I think a court physician to one of the Louis of France, so presumably the king had Peyronies. And you can surgically do it, and I tell people I can either put an equal sized piece of tape on the other side and torque it straight. I can try to remove the tape, but if I remove the tape, I'm taking the wall of that balloon with me. So I gotta like put something in there, a lot of patching. If I put the piece of tape on the other side, it's straight, but now you still have these two things there and everything's gonna be a little shorter. Or in 2013, we now have an FDA-approved treatment for this, which is an injection of collagenase, something that melts collagen. You basically inject it into the piece of tape and you're melting it away. And that can help restore length and restore girth and decrease the curvature. There are some medieval torture device looking things called traction devices that you can use to stretch the penis in combination. Sounds like it'd be painful. It's not painful. It's maybe a little annoying, but it definitely helps the treatment of Peyronies a lot. And so mostly what we do is this injection medication now because it's very, very helpful. There's one of the problems in medicine is that we usually define treatment outcomes in like percentages, numbers. That doesn't really capture how people feel about it, right? So there's the numerical amount of the curve, but I could have a patient with a 20-degree curve and he's devastated. And I could have a patient with a 50-degree curve and he doesn't care at all. So just the curve is not enough. You have to ask the patient how much are they bothered. And I feel like what we're primarily treating is their degree of bother with this. And that may be not related to the amount of curvature at all. Unfortunately, Peyronies is one of those conditions that has a very, very high amount of bother. I think people don't really appreciate it, but with Peyronies, you can have significant depression, anxiety, There's been some population level studies done in Finland that show that Peyronies is associated with alcoholism, depression, suicide, right? Very, very, very serious things. And so when we're treating these men, we're taking into account all of those psychological ramifications in addition to the actual medical treatment of their scar tissue. There's a hand condition called Dupuytren's contractures, where it's basically your hand's kind of tight. That's the same condition as Peyronies. If you have that, you're very likely to also have the predisposition to have Peyronies as well.
So it doesn't cause any other health condition, nothing there that you need to worry about.
Right.
It's the amount of bother that the man has, or maybe the man's partner, or
Yes.
in relationship.
Yeah, you know, sometimes people come in and I feel this thing on my penis, I just want to make sure it's not cancer. Like, it's not cancer, it's just scar tissue. Does the scar tissue limit or impact your ability to have satisfying intercourse for you or your partner? I'm fine, she's fine, all good. Don't worry about it then, don't treat it. You're not bothered, she's not doing it, right? If, however, you can have pain, the partner can also have pain. Imagine, I've seen curves 90, 120 degrees. You can't even have sex with that kind of thing. So there can definitely be significant sort of symptomatic bother that doesn't necessarily correlate with the actual deformity. Right?
Okay, so injections, if I'd like to go back to that, how many injections, for how long?
Yeah, it is not an easy process. Injecting is stuff, it's called Xiaflex. It's a collagenase, a melting collagen. It's 8 injections, and you do 2 injections in 1 week, and then you take 6 weeks and you do stretching and modeling, and then you do 2 injections and then 6 weeks, and a total of 8 injections. So 4 of these little 7-week cycles, right? So it takes 28 weeks. It takes half a year.
Wow.
But it is the only potential therapy that has the ability to restore the penis to its previous state. If I just stitch the other side and make it straight, I'm just making it shorter, and now you have stitches and the plaque. So my only hope of trying to give you back what you lost is to try and treat the actual problem, which is melting down the scar tissue. Some patients, they have calcified plaques, meaning it's literally turned into bone. You can't inject bone. You have to cut that out. So we can do surgeries. These are big surgeries. Not a lot of people do them, but we can do a lot of work there. And you know, it's a little scary thinking about doing that on a penis, but we've done those as well.
So follow-up, so if someone comes in, they're not bothered, their partner isn't bothered, and everything, but they've noticed a difference.
Yeah.
What is the follow-up after that? Is it that if they see change after that, or is it do you say come in once a year?
Yeah, great question. The acute phase of Peyronies, when it's changing, can vary between people. For some people it's 6 months, for some people it's a year or 2. What I want to do whenever I see them in that earlier phase when they've just noticed it is to arrest the maturation of the plaque, stop it from getting worse. Patients rarely naturally heal these things on their own, so buff up the erections, daily Cialis, something like that. You can give some medications that have some anti-inflammatory potential that can help. You can still tell them to use a stretching device, and you tell them take care of the penis, you know, or gently put, choose positions in which you're in control, as I talk to the guy, and in which you are less susceptible to injury, right? So maybe less reverse cowgirl, you know what I mean?
Okay, no, that's a good point.
Yeah.
I mean, that really is. That's an injury.
Yes.
Greater risk of injury.
Right. So you want to have sex in a safe position with a really, really rock solid penis. What you don't want to do is have sex in a dangerous position with like a mediocre erection. That's when we think people are most susceptible to get the injury that then causes Peyronies disease.
Oh, the injury causes. So that's the cause. So the
Yes.
cause of Peyronies is injury in that instance.
Right.
Like
Whether it's a
injuries.
macro injury or just wear and tear, micro trauma. Right. This is a like I said, an orphan disease even within urology. Most people unfortunately suffer this in silence. There's not as many good resources out there. Most physicians don't know how to treat this very well, so you go to a doctor or 2 or 3 and they tell you, you know, don't worry about it, you know, just do whatever, take vitamin E or some of these old treatments. There are treatments, they're good treatments, you just have to get to somebody who knows something about Peyronies, right? So a specialist in that area. And it's a big part of my career. You know, we do a lot of the Peyronies work in the Dallas-Fort Worth area. I enjoy this disease process because I think we're helping an undertreated population of men.
So what would people look for? What would men look for if they are thinking, oh, maybe this is me?
Yeah, you're classically a lump, a bump, a curve, or pain or any other type of deformation of the penis. It's not always curved. It may be hourglassed where it narrows in at one point. It may have a hinge defect where there's a tight spot and it feels like the penis doesn't have structural support at that site. It may be causing pain, usually not when flaccid, so only pain when you have an erection. These are all things, and most men are pretty aware of how their penis is. In some men, they don't have any of those. They just have shortening. They're getting fibrosis and atrophy. And the thing that makes all Peyronies worse, diabetes. It makes erections worse, and it makes the Peyronies worse. So, but like I said, it's up to 10% of men. So a lot of, you got 10 buddies, somebody's got Peyronies. But sadly, or understandably, people don't talk about it. And one of my big sort of pursuits in my career is to try and advance this as something that's okay to talk about, normalize that, and get more men treated.
Yeah, I can imagine there's a bit of shame in that space. You have a change in your penis, and so then you don't know who to talk to about it.
Right.
How long on average? A couple years before people come talk to you?
It's always the extremes. It's either like 5 years or like 2 days.
Yeah.
Having partners that are understanding and supportive is very helpful. Like with so many things in medicine, so much of what I do, because it's sexual medicine, requires or is benefited by having a supportive and understanding partner, whether that's fertility, which obviously requires a partner, or just sexual medicine, orgasm, ejaculation, erections, all the kind of stuff that we've been talking about. It's very helpful. But even if you don't have a partner, that's what we're here for, to help support, and there are resources and we can help guide people through. There are patients who have this and they're single, and it prevents them from dating because they're embarrassed or they're ashamed or they're unsure about the ability to kind of get an erection. Some of those patients will do Peyronies treatment. Sometimes they have Peyronies and they have erectile dysfunction, so we have to treat both. Sometimes the treatment for both is a penile implant, which basically gives them the ability to get the erection. It straightens out the erection, and they have the confidence and restored sense of self as a man to basically use that implant and go out there and be able to date and have sex and know that if it comes down to a sexual encounter, he'll be ready to go.
I'm so glad you're doing this work.
Thank you.
Thank you so much for joining us.
It's been a pleasure, yeah.
Please let everyone know how they can reach you.
Yeah, so my practice is called Urology Partners of North Texas. We're in the DFW area. We have 7 locations and 30 providers. I direct the Men's Health Center, where we specialize in men's sexual health and fertility. You can find us online at www.upnt, urologypartnersofnorthtexas.com. And then, like I said, this is a huge field of interest for me, Peyronies specifically. It's where a lot of new research is done. It's one of the few things that there's literally only one FDA-approved treatment for. I'm hoping someday we can have 2 FDA-approved treatments for it. There's a lot more work to be done there, but definitely a treatable condition that you don't have to suffer in silence, and a big part of my work is advocacy for that.
Yeah, so if you have any questions, please reach out to Dr. Sun. He'd be happy to help you. Please stay tuned after these messages for our next guest.